I also wanted to look at the structure of MOH, and I'm cognizant of the time. I wanted to look at the structure of MOH. I thought MOH was too centralized. It is one of the most centralized public health ministry in the world. And I think we have to devolve more powers and responsibilities to the states and to the hospitals and to private healthcare, which means a whole transformation process which would have taken years, which means budgets, which means hiring, which means making sure that programs are designed specifically for that particular community. And I was very mindful, and the easiest thing for me to do is to keep the structure. I would continue to be the most powerful minister, and ministers after me would continue to be the most powerful minister. You're the biggest provider, you're the sole regulator, and you're the biggest purchaser of healthcare in Malaysia. You can imagine the inefficiencies that come with a monolith like that. And it should as well. But I wanted it to do better. And I thought that this would be the way to do it. So those were some of the things that I looked at. I mean, there are many other things, but I'm trying to summarize as quickly as possible. So that we had the building blocks in place for a better outcome. I wanted, so apart from sick care to healthcare and wellness, I wanted to make sure that we had 1 million Malaysians stay healthy for 10 years, every year. So 10 million Malaysians not falling into chronic NCDs. Because when I did a back of the envelope calculation, about 1 million Malaysians fall sick, as in end up having diagnosed NCDs every year. So I wanted to keep 10 million Malaysians out of that NCD list over 10 years. That was the big idea. And it was not just about the Ministry of Health. I mean, the last point about the health paper, I wanted it to be something whole of government. And this is something I learned during COVID. In COVID, if you relied on the Ministry of Health alone, you could not have achieved what we achieved, some of the highest vaccination rates. We had to work with other ministries. We had to work with the private sector. We had to work with private GPs. And I thought to myself, this is not about privatizing healthcare. It's about optimizing the resources that we have. Every time we talk about working together with the private sector, there will be those people who say, oh, this is the start. This is the slippery slope towards privatizing our healthcare system. No. If during COVID, I sat on my hands and said, okay, I don't want to work with the private GPs. There are 8,000 GP clinics in Malaysia. Then that would have been criminal, because I would not have been able to achieve the rates of vaccination that I did. By a similar token, we have to start thinking about how we can purchase services at the right price, and I know Dr. Zul is doing this, so that we have better quality of care, and better access to cutting-edge treatments for patients who require that, cancer patients in particular. So these are things that we were working on, which I hope will continue, and which I hope will see a better utilization of resources. Imagine 80% go to public hospitals, 20% go to private hospitals. There's a huge amount of excess capacity in the private hospitals that are not being used. Of course, it costs more, but there is a way of designing a payment system from the government so that we refer deserving cases to these specialists. For clinical trials, we work very hard to make sure that Malaysia becomes a hub for clinical trials through CRM. We also have our homegrown researchers, Cancer Research Malaysia. And this is important because although for clinical trials, we are now just seen largely as a site for clinical trials, it does expose us to some of the more advanced treatments that are available. It builds the confidence that we have principal investigators who are world-class, clinical research centers which are world-class. We have patient enrollments which are good. We have a broad genetic diverse makeup in Malaysia, and that can only help because it can bring pharma to come here to introduce their treatments in Malaysia. I wanted to touch on one last thing, which is I thought after the white paper, I needed to do one more consequential thing. I didn't want to do too many things. I wanted to do one more consequential thing that had a direct impact on the coming epidemic of epidemics in 20, 30 years' time. And that was I wanted to end smoking. And I mean, this is easier said than done. But I was in a WHO meeting in Japan in 2021, and the New Zealand minister was speaking via video call, and she was telling us that New Zealand wanted to pass a law where everyone born after 2009 could not buy a cigarette anymore. And then I turned to DG, was next to me, DG Shang, and I said, hey, do you think this will work in Malaysia? And I think he said something like, good luck to you. And I thought, maybe this has legs. I mean, of course, there are many, many issues here. Implementation, enforcement, black market, we've heard all of it. But I felt we were on the cultural cusp of a change. You know why? Because amongst young people, now, today, smoking is not cool anymore. So I felt that we were at the cusp of a change. If smoking was still regarded as cool, then maybe it's difficult to enforce this law and the behavioral change that comes with it. But I noticed that young people nowadays, they don't want to smoke. Of course, there's an slight increase in vaping and things like that, but I felt it's something that we could tackle. So I introduced this generational endgame, because I said, imagine you have a law and you don't have many laws that can save millions of lives. That's what I said in Parliament when I tabled the GEG before the elections. I said, imagine voting on a legislation that can save thousands of lives. Of course, there are many, many laws which are good for the country. All laws should be good for the country. But one so consequential, where we would not allow anyone born after 2007 to buy a cigarette or to buy a vape or an electronic nicotine delivery device. And I thought, of course we have challenges, but we can overcome the challenges. I mean, we had just come away from inoculating 80% of the population within months. So I thought to myself, if we really wanted to go at it, we can go at it. And that's the kind of thing that you need in the Ministry of Health. Ambition to want to have something consequential, not just to treat the patient when they come in with lung cancer, not just to treat them when they come in with chronic obstructive pulmonary disease, not just to have to treat them for cardiovascular disease, which costs you, 6 billion every year, this year. And your collection from cigarette tax is only 4 billion ringgit. Even the mathematics make sense. So I said to myself, this is something consequential that we must do. And unfortunately, coming back to the story of having new ministers at new times, we had the act, it was passed in Parliament, but unfortunately that part on GEG was not there. And that saddened me, because it showed a lack of ambition, it showed a lack of consequentiality, of wanting to make a difference, a big difference in the future. The act as it is good. It regulates things, fine. But that's what it does. It just regulates things. It doesn't shut the door on something that we know contributes towards poor health outcomes. So ladies and gentlemen, that's a little bit about what I did at the Ministry of Health. I wasn't there for very long, just over a year. It was probably the most rewarding time in government for me. I served in 3 ministries. I don't know if I'd do it all over again, because it took a tremendous toll on my physical and mental health. You do not wish the Ministry of Health on your enemy. If you are a minister who doesn't care, it's fine. But if you're a minister who cares about your job, then that job can kill you. That job can kill you. Because every day I wake up thinking, this is about people's lives. This is about providing the best care and access to healthcare for Malaysians. Thank you for giving me that honor.
Thank you so much, PJ, for that very interesting point of view on different challenges and aspects that you faced while in the Ministry of Health. And bringing up about COVID, which was, can you believe it, 4 years ago, it hardly seems like it was just last year or a few months, and yet here we are. So thank you so much once again, and we will be starting our next session, a very interesting panel discussion. So I'll be inviting our panelists one by one on stage, and please allow me to introduce them. The chair for this session is Prof. Elil Renganathan, who can come up to the seat, and he's not just part of our steering committee of the NCCM 2024, he's also a professor of public health and policy at the School of Medical and Life Sciences here at Sunway University. Prof. Elil is also a senior international expert with extensive leadership experience and expertise in public health, global health, evaluation, and organizational learning. Over the past 30 years, he has held positions in public health with a spectrum of strategic and managerial responsibilities, including over 24 years in leadership and global roles in the World Health Organization. Welcome him. Next up, we have Dr. Feisul Idzwan Mustapha. Dr. Feisul Mustapha is a senior medical consultant in public health, best known for his leadership in the prevention and control of non-communicable diseases (NCDs) in Malaysia. His special areas of interest include diabetes, cardiovascular diseases, cancers, and obesity. At the Ministry of Health Malaysia, he is currently the director at the Perak State Health Department, responsible for the overall planning, coordination, and implementation of all medical and public health programs and activities in the state of Perak. He combines his high-level experiences in the government with active engagement of civil society and multilateral institutions. Dr. Feisul is currently chair of the Scientific Advisory Group for the Monash University Southeast Asia Community Observatory, SEACO, and he was previously a member of the Strategic and Technical Advisory Group on the Prevention and Control of NCDs for WHO Geneva. In addition, Dr. Feisul has special interest in leveraging on technology in catalyzing behavioral modification to reduce the exposure to NCD risk factors. Thank you so much for joining us today, Dr. Feisul. The following panelist is a consultant hepatologist from University Malaya Medical Center. She holds significant roles in global and regional hepatitis initiatives and is the founding co-chairperson of the WHO Strategic and Technical Advisory Committee for Viral Hepatitis, contributing to global efforts in combating the disease. Locally, she assumes the role of master at the Academy of Medicine of Malaysia, overseeing various medical specialties across the country. Actively involved in the Malaysian Medical Council, she influences policies regarding medical specialist recognition, training, and professional development. Additionally, she champions hepatitis and cancer advocacy as the president of Hepatitis Free Malaysia, reflecting her commitment to public health. Her multifaceted roles underscore her dedication to advancing healthcare both locally and globally. Please join me in welcoming Professor Dr. Rosmawati Mohamed. Next up is a scientific advisor, head of the Cancer Awareness and Professional Development Department. He has travelled far and come all the way from Qatar Cancer Society. And he is also in the following: the National Cancer Governance Board in Qatar, Gulf Federation for Cancer Control, Union International for Cancer Control, World Cancer Day Advisory Group, World Ovarian Cancer Coalition, and the All-Can International. Not only that, he is also an adjunct lecturer at the College of Health Sciences at the University of Doha for Science and Technology, a preceptor at the Department of Public Health, Qatar University, Psychology, and Social Work Master's Program at the Doha Institute for Graduate Studies, and Mohamad Medical Corporation Community Medicine Residency Program. Let's welcome Dr. Hadi.
I'm gonna ask you as a kind of MC for our congresses. You have a very good public speaking skills. You need to be a minister.
So many decorated and distinguished individuals with us today, folks. So we shall start. I will respectfully hand it over to the chair of the forum.
Thank you very much. You will agree with me, it's a hard act to follow. But we'll try our best because he's with us. Yeah. In today's complex world, and health challenges are increasingly interconnected, as most of you are aware of, and I think this Congress has tried to show that, reflect that. We have to think about social elements, we have to think about economic elements, environmental factors. Addressing these challenges, you would need coordinated efforts from various sectors of society. And one of the nice things I felt about this Congress was we were seeing people from all different sectors of society coming together to discuss about cancer. Our panel will look at how different stakeholders can contribute and collaborate to advance our collective health goals towards a healthier nation. Yeah? We're fortunate to have a very distinguished panel with us. I'm not going to go and explain who they are because that's been already done. We'll touch on key concepts that Khairy had raised as well, the concept of whole of government, the concept of whole of society, and then also concepts like health in all policies. So we're hoping that through the questions and discussion, we'll get there. We have a slightly shortened version, so I'm going to get quickly to the questions. I'd request that the panelists, keep it short and punchy. I want to start with you, Khairy. Yeah. You mentioned something there. You mentioned about your experience, but you did say something about how government can better coordinate across different ministries to help the health issues, to address health issues. Do you have anything else to add to that? What you just said?
Yeah, thanks, Dr. Elil. So when we looked at whole of government policies, I wanted my public health specialists to really understand their role, not just in terms of studying epidemiological patterns of disease in the community, but also to understand the non-health determinants of health outcomes. That was very important for me. And when you talk about non-health determinants, you're talking about social determinants, you're talking about economic determinants that has an impact on health. That's where it comes to health in all policies. Because if you want to succeed with the vision of the healthcare white paper, then you really need to look at things beyond the perspective of the health ministry. And what am I talking about? When I speak about NCDs, for instance, it's easy for us to blame people and their lifestyles. There's something that I alluded to just now. But the fact of the matter is sometimes that's the only nutrition or food that's available to them, which is not nutritious. They are tired, they're working a few jobs. The easiest thing is for them to buy some fast food for their kids because it's cheap. So we're not doing enough, for instance, in making sure there's enough nutrition security in the country so that it is affordable and accessible, one. Secondly, we have to start looking at the built environment, and that's your work ministry, your local governments, about how the built environment can also have an outcome on health, on how we design our buildings, on how we design our cities to promote better mobility, as opposed to promote highways and cars where it's very difficult for people to get their steps in every day. We have to start looking at the fundamental issue of poverty and education and tie that into healthcare. Because when someone is poor and someone is not educated, then it's very difficult for them to understand what they need to understand when it comes to their healthcare, when it comes to getting preventive healthcare, when it comes to screening, what to do if they are sick. So all these things, and you can go through every single ministry, and there will be definitely a lever of policy there that has a direct impact on healthcare. And that's what I meant by a whole of government and health in all policies approach, where it's important for the Ministry of Health, especially our public health officials, to go to other ministries and say, hey, look, can we talk to you about your ministry and what you're doing to make to making sure that we have a healthier Malaysia. There's a point of correction just now. I said 40,000 permanent posts. It's actually 4,000. But nonetheless, it's the biggest increase since 2016. But anyway, coming back to the point, so that's what I meant by embedding health in all policies.
Just to follow up, the processes that you set out, or how did you get to the other ministries?
Well, it's in government is very difficult. So I told my public health officials, because in any given multi-ministerial task force, Ministry of Health will be there. I said, you must be the biggest busybody in government. That means you must get in the face of every other ministry, because health is embedded in every other ministry. And of course, I'm very careful about overreach, because after COVID, everyone thought MOH was overreaching in so many different things. But it was important for us to continue the momentum, to say that, hey, if we had a whole of government approach for COVID, we should have it for non-COVID time as well, for other policies as well. So it's a bit of tactical maneuvering to making sure that Ministry of Health has good relations with other ministries. Ministry of Health is clear in what we want from other ministries, and to make sure that we have good stakeholder management with other ministries.
Thank you very much. Feisul, I think it's a good segue, because it'll be interesting to understand how you set about looking at the national health priorities and trying to promote that at state level.
Right, thank you very much for that, Elil. Well, before I answer that question, Elil, just let me share with you. You hear now KG talking about the determinants of health. Actually, the first time I've heard him talk about it when he was still in KBS, Kementerian Belia dan Sukan, Minister of Youth and Sports. Could have been in 2014 maybe. 2014, and I was working at ministry at that point in time, and my first thought was, I wish all the other ministers were already talking about these determinants of health. So that's the first point I'd like to share with all of you. So I'm not sure who was advising him, definitely wasn't me, although I was responsible for the NCD program at that point in time. Secondly, just to reiterate, having a good master plan and the health white paper, I've heard KJ do that same pitch twice already. The first was at the policy summit that you did. If I'm not mistaken, it was in 2022, August, in PWTC, and one thing that stood out, and that's when you talk about the 5%, here is a health minister who was willing to commit time, not just for the launching ceremony, but to be with us for the longest period of that policy summit. And thirdly, to NCSM for organizing the other meeting on UHC. I wish most of you will be there, where we had all three ex-health ministers. Was you, Dr. Zul at that point in time, and Tan Sri Subramaniam. We didn't get your camera, unfortunately. So it just goes back to my earlier point about having strong advocates. Earlier I think about advocacy. So you need your champions to be there, because ultimately it boils down to good leadership. Not just good, strong leadership. Right? Where I am, of course, I have some autonomy, or limited autonomy, where I operate in the state of Perak, because we are very much centralized. A lot of policies come down from ministry, so I don't have much leeway in that manner. What I could do is more make sure that everything's aligned, and prioritization in the face of limited resources. Right? Regardless, when we talk about the working together at the state level, I do engage with the state government, and I see the point made by KJ in terms of getting in their face. I think it's more building relationships So spending the time, making the time to understand the challenges faced by the state government, the other excos, not just the health exco, the other excos as well. And just to share with you, in the state of Perak, the key priority is actually SDG 1 and SDG 2, poverty and food security, ending hunger, or in a way food security. And I think for step 1, once I've understand where I could get in and speak the language of my stakeholder, then we'll be getting in there and to see whether we can find areas where the, what shall I say, interests overlaps, and we can have health gains at the same time they can gain what they need on their part as well, because you can't just make health arguments really with the other sector. I'll stop there.
Thanks a lot, thanks a lot. Prof. Rosma, research institutions, how can they contribute towards evidence-based policy setting?
So tremendously, so I think this is a very good actually time to really look at what is needed. So anything about trying to position the response, so in this case we want to position the cancer response. The first thing we need is data, and without data we would not understand the gaps, where to address our key action plans. So I think the main role at this time is not just research institution, and I think everyone involved in wanting to have some role in advocacy in cancer must also know the data behind what needs to be focused on. So I think that's the main thing. So here, I think what the other thing I would like to focus is that a lot of actually discussion at the Cancer Congress will say that, okay, we need to focus on cancer, but at the same time, we must not forget the elephant in the room, and quite a number of times it's been mentioned about NCDs. And we also have to think about what is the number one killer, not just nationally, but globally, which is actually heart disease. So let's look at opportunities, not just from the research perspective, but from your action plans on how we can view this holistically. And of course, being a liver cancer specialist, I would actually say that the first thing that I would need to do is not look at just liver cancer, but look at how do we address this holistically and integrate with the NCD strategies. So there is opportunity. Unfortunately, these opportunities come from data which are alarming. The first is looking at the prevalence of fatty liver disease amongst the Malaysian population. And you see, for the very first time, the National Health and Mobility Survey has included the prevalence of fatty liver disease in our Malaysian population. Alarmingly, 3 out of 10. Very similar to the glaring data from worldwide figure that 1 in 3 adults suffer from this. But what is the significance in the liver cancer field? Because we've already shown data that the majority or the fastest growing cause of HCC, not just nationally, but also at the global level, is also fatty liver-induced liver cancer. So we're talking here now, the latest data from Malaysia, 42% of HCCs or liver cancer are caused by fatty liver, and the first and has always been hepatitis B. From 60% about 10 years ago, it has reduced to only about 44%. And not because the numbers are reducing, there are some reduced numbers among those who have been vaccinated, of course, that you don't get that. But we are saying because the sheer number of the problem from fatty liver-induced HCC. So I think here the data is important. Focus on what can impact people, policymakers. And the other thing to actually really highlight again is what we saw in the preview of our latest National Cancer Registry, which was shown on Friday. To say that liver cancer is now the 5th most common cancer, rising in keeping with the global trend, which is also showing increasing liver cancer death and also new cases.
So do you feel that academia is being engaged adequately by the policymakers?
I think there have been attempts, but a lot of times you cannot wait for, say, for example, policymakers, mainly coming from MOH, for them to invite you. You have to show yourself. I mean, do this by showing the numbers, showing your publication, showing these are the ones that can impact and can reduce the cancer burden. So I think definitely, ultimately, we need to work together with the Ministry of Health to actually get the data across.
Thanks, Professor. Hadi, it's a very unique situation because we've got national perspectives, and currently in public health, global health, you speak about the concept of glocal, which is global plus local. Yeah, so that's what we are trying to achieve in this panel. So, Dr. Hadi, from your experience in Qatar, and also from your experience from many other countries, how do you think NGOs can effectively collaborate with governments and other stakeholders?
So thank you so much. It's actually, I just want to kind of reflect on the importance of first the health care white paper. I really admire this work. This is a very important, I would say, advocacy project. It's transformed, I'm sure, the life of Malaysian, and I think this is could be a successful study, could be replicated in the whole region. And I totally agree with the importance of data, that we need to go out there and share the data with the policymakers, because data is not being communicated, hidden somewhere in publication without sharing with the policymakers. It has no impact. It has no impact whatsoever. So about your question about how NGOs can collaborate with the government, first and the most important part, how NGO, they need to be the critical players of having meaningful involvement of patients in policy in policy development. So without really creating opportunity of patient voices and meaningful involvement of the patient to be part of policy making at the level of the government, all policies will be done without having will not meeting the patient needs. So this is it will meet what they think it's their need, but without meaningful involvement will not have an impact. Also, in addition to work at the policy levels, let's say bring the concept of public-private partnership to the government, because sometimes the government, they have so many red tape and red line. You cannot cross this. You cannot. So NGO can really bring forward public-private partnership into the let's say the healthcare ecosystem and bring it forward. In addition to community mobilization, making sure that the cancer awareness, cancer risk reduction, prevention, all community partners are involved in the let's say, not, instead of focusing only on treatment, focusing also on the risk reduction. Every entity in their place. And the other aspect is, I think we had the discussion before in the previous talk, NGO can really push the agenda that we need to look for better efficiency, because as an NGO, we really, the NGOs in a situation that they are looking out for funding. So they know how hard it is to get funding for their initiative. So they appreciate the concept of efficiency. And I think reminding everyone of equity and efficiency aspect in health initiative, that's what NGO can bring to the table. And also the aspect of, as a non-profit organization, they also work at the level of overcoming. And I think COVID was a clear example how civil society and NGO played the role with the government on sharing a cost, on improving access. So so improving access to healthcare service, better quality, that's actually expectation from the NGO to work with the government. So I think we always, the NGO is there to complement what the government is doing. It's not as a competition, as a complement. That's, you see some part of the world, the government look at the NGOs, they are just coming to take over what we are doing in education and support. This is our area, why they are getting involved in this. No, actually, we are there to complement what the policymakers are doing and helping of making sure that their program that they are implementing is being accessible by all in an equitable way, and there is no anybody is underserved or not having access to those programs.
Thank you. I think one of the exemplary aspects of this Congress has been the interaction and the collaboration across a lot of stakeholders, including the private sector. And often in public health, when you talk about collaboration with the private sector, conflict of interest always comes up. In your dealings, how do you manage that?
So that's a very good question. So actually, when we work with the private sector, we lay out our vision. This is our vision. What's your vision? And we kind of work with the private sector, and then we meet in the middle. We kind of work on a common vision, common interest, and we focus all of our activity in this common interest. It's like Venn diagram. They think of this. We think let's focus on that collaboration. And then we move it forward in an ethical way, in an area that we make sure that there is no let's say unethical perspective. And at the end of the day, the whole concept of we totally understand sometimes the commercial aspect can impact the health, but also at the end of the day, we don't need to make it like as a taboo. I mean, we can. I mean, you are already dealing with taboo, the relation of stigma of cancer. We cannot add another stigma of working with private sector. That's we're already dealing with enough stigma in cancer. We cannot add another stigma of working with private sector.
Thank you very much. Tuan Khairy, your representation of the whole of government approach was a little bit rosier than I was expecting. What kind of challenges did you face?
Whole of government or whole of society? Okay. If I'm to be very, very honest and frank, so before I went to the Ministry of Health, I had to run the COVID immunization program as the Minister of Science, Technology and Innovation. So although I had a very, very good working relationship with the Minister of Health, when your hand is not on the lever directly, it's tough. Because, obviously, institutionally, the Ministry of Health will be like, why are we taking instructions from another minister? This is not correct. Although those things, I think, smoothened out after a while, but it was not easy because there is ultimately in government a lot of turf gatekeeping that takes place, which I think ministers have to continue to work to smoothen out. I found that turf gatekeeping to be one of the most frustrating things in government, because I think that ultimately, if you work together with other ministries, they care about getting credit, right? So you can share the credit if that's what is important to you. It wasn't important to me, but for others it was. So I went out of my way to say that if we do something together, then we jointly get the credit. And I'll give you an example. So when I became health minister, I had to take. So by then we had a new prime minister who was very good. Ismail Sabri was very good in a sense that he devolved the decision making for all the COVID controls to a committee. Before that, it was discussed at the highest level. Can you imagine how many hours you were allowed to go out? How many people can go into a restaurant and things like that. And I sat through so many of the meetings thinking, the half the cabinet and the prime minister shouldn't be talking about this. So Ismail Sabri came in and he said to me, you run it. There's a quartet of you, 4 ministers, Minister of Defense, Minister of Trade, Minister of Health, Minister of Communications, and you sort it out. I will endorse it in cabinet. And I found that to be revelatory in a sense that he said, he owned it as the Prime Minister, but he entrusted his ministers to make the decision. And between 4 of us, there was none of us wanting to take more credit than the others. We gave each other due recognition for decisions that were made. So I think COVID was good in a sense that it allowed us to elevate ourselves beyond normal territorial turf wars. But I think obviously it's tough to do it in a non-COVID era, because people are traditionally very, very possessive of their turf. Coming back to the whole of society approach, I wish that we continue with the spirit that we did in COVID, especially with public and private sector. I think what Dr. Hadi mentioned earlier resonates with me, because every time we raise working together with the private sector, amongst some people, it is met with extreme derision, saying that, as I said earlier in my speech, that this is the slippery slope towards privatizing everything, as though there's no middle ground somewhere. And to me, it's about the efficient utilization of resources in Malaysia. Are you telling me that, 50% of the healthcare resources, which is underutilized right now, cannot be brought into the national healthcare vision? Of course they can, and the private sector wants to. There is a cost to it, but this is something that we can work out, and we were working out on the right level of demand centric models to come to the private sector to say, this is what we believe is reasonable for buying services from the private sector. So I think these are some of the issues and challenges that we face.
Thank you. Now, an ex-WHO Director General Margaret Chan used to say that everybody who can and has to contribute to public health has to be sitting around the table. But she also told us that if you're not at the table, you'll be part of the menu. So I'm trying to push the health folks to be always engaged. Yeah, Feisul, your challenges as you are trying to work with others.
I'll start first with working with the private sector. I think this is not just unique to Ministry of Health. I think it's more the government. While we often talk about PPP, public-private partnership, I think the process is what I have mentioned earlier as discretionary. So, if Minister likes this company, he can work, and Minister change. So it's discretionary. It's a black box. What can be better if we have clear rules of engagement? So as even as a state health director, if there is such a thing in place, where there is accountability and transparency in how we engage. It doesn't have to be procurement of services. Working private sector can take many shapes and forms. But without these clear rules of engagement, with mechanism for accountability and transparency, and very clear monitoring mechanisms, make sure that, and even anyone who's inquiring can see, okay, X amount of money or X amount of resources going in, and these are the outcomes, and whether it is value for money or not value for money over time, that will be certainly something useful. And going along the same line, and this is part of the discussion on the health white paper as well, is about autonomy. We are very, we as MOH, are very centralized agency, which means that even the state health director we have a lot of autonomy. We don't. So having autonomy for resources allocation, even human resource, full autonomy will be something which can make it easier for us to look at our own context and to see whether our limited resources, even programs. So one of the complainants earlier was that MOH is running too many programs, right? And even in the specialties as well, we're doing too many disciplines, multi-subspecialization, which comes with different set of issues. When you have limited resources, difficult decisions have to be made. Where do you allocate and where do you scale down when it seems unfair? And I don't have that autonomy right now, the way the system is set up. And because it's about the challenges I face right now, is well with what you read often in the social media: limited resources, limited human resources, or buildings, or equipments. And I think we can do better if we can reallocate these resources and actually focus some resources on certain centers. So even in Perak, just speaking to KJ, we have 15 hospitals, 88 health clinics, 222 community clinics. I have 26,000 staff under my responsibility. That's a lot of facilities and a lot of staff. And God knows how many programs coming down from MOH. And I used to work in MOH, and in HQ. So I know how the games are played. So I do know that as if I have more autonomy to redirect resources, that will be something useful. And if I may, just to continue from what Prof was saying about outcome of research. So this is more putting my policy design ahead, cap in my head. Data is important, but for the researchers out there, my plea to you is that I'm time poor. I don't have time. Even if your paper was published in a BMJ, even in the Nature, if it's 20 pages, I don't have time. It is about how you advocate and again how you sell it to whoever that you are seeing. Does matter. If it's the minister, if it's the DG, it has to be your elevator pitch, and it is what's in it for them. So unfortunately, when you have your paper published, it's not the end of your journey, it's just the start of your journey. If you really want the people in the right places to make decisions, to act on the results of your study, to make a difference. And this is where the challenge is for some that I have encountered. The focus is too much on the research itself and not really asking the question, what's in it for me? As the person you are targeting. My lecture on advocacy still applies. You need to know what are my concerns, what drives me, and that if you could figure that one out, then most likely the policymaker will make full use of the findings and would want to play or work with you to optimize that, because unfortunately we don't just make decisions based on facts or data. There are other things that comes into play in decision making, especially in policy making.
Thanks a lot, Feisul. Since coming back to Malaysia and joining a university, one of my mantras has been evidence, policy, practice. And most of the universities spend time on evidence, and they are circling around the evidence. We need to make sure that it, goes on to policy, and that goes on to practice. Prof. Rosmawati, how do we engage communities better in decision-making, policy setting?
Sure. So I think we will actually have to possibly the lessons learned from hepatitis C would be the best way to actually look at it. Because the success story in hepatitis C, when the curative treatment of direct-acting antivirals were available, it was cheap because it has not just generic. The voluntary licensing has meant that you can get a cure with just 3 months, with just around 1,000 ringgit Malaysian. But although we were very good, we managed to get access to the treatment in the hospitals. In the community level, that's not happening until later. And even then, it's not scaled up. Because I think one of the best effective response, if you want to see it happening in a big way, it has to be decentralized to the community with the primary care physicians and with community champions. So what is the main lesson learned here is just look at again the Egypt, which managed to cure millions of people with hepatitis C within a very short period of time. So their focus is actually building capacity, not just on the treaters, the whole spectrum in the continuum of care needed for that hepatitis C treatment to happen, which means from diagnostic to testing as well as to the treatment, and then see how this can you build capacity at the community level. So similarly for cancer, we need to think about a way to actually do this task shifting to the community champions, starting with the primary care physicians, but others as well. It doesn't be restricted to doctors. So one of the best way to show this is, again, when I want to give an example, I actually can tell that the inclusion of screening for fatty liver disease, for example, in the type 2 diabetes clinical practice guidelines, has actually put fatty liver on the radar of people other than the hepatologists or the gastroenterologists. Now, everybody needs to know. So your champions here are going to be champions, not just liver champions, they're champions in an interconnected area here. So here, this is the way we need to do things. So first of all, we're talking about this as an NCD. We also will have to highlight that it not just you're not just picking up fatty liver, you're going to pick up those who are at high risk by doing the liver disease stratification of developing two things. One is liver cancer and cirrhosis and its complication. The other is also those that are high risk of cardiovascular disease and death and other malignancy as well. So basically here, this can be done very cheaply using a free model of building capacity. I gave a talk yesterday on how we can use the ECHO model, which stands for Extension for Community Healthcare Outcomes, which is a free transformative initiative using just simple Zoom platform, but with other caveats. It's using the 4 principles of A, amplification, where you build capacity by connecting to many others in the community. Then B, by best practice sharing, by using the clinical practice guidelines, a simplified algorithm to actually get to the people. And then C, case-based sharing. So you get those who want to have this treatment to actually share with you the cases so they can then master the complexity that may be involved. And D, you need a database to monitor outcomes, and the ECHO platform has got already that. So basically here we're talking about expanding access to in the entire spectrum of the cancer care continuum, which can be done free, but you must have a leader. I mean, someone to lead, at least to show this is the big picture that you want to do. What is the big picture that you want to do is, for example, for us, we look at the 4 pillars. First is one thing to strengthen the data we set. The second is early ACC detection by optimizing and scaling up the risk factors relating to ACC. Then only you can detect to prevent the ACC and at the same time have early detection at those that are high risk. But the third one also is access to a multidisciplinary team, because now ACC is not treated by one person. It's actually treated by a whole group of oncologists, interventional radiologists, hepatobiliary surgeon. Us physicians are also still very important, especially looking at the cases where treatment can even not just stop the progression of the liver disease, but can also act as a tertiary prevention for recurrence. So here, we need to get someone to look at the overall picture and see the role where the community focus will be, which is on the early detection of the ACC risk factors and preventing.
Okay, thank you very much. I want to do one last round of just thoughts and final comments from each of you. Hadi.
So, if you ask me what's my final thoughts on how we put cancer and health agenda in a better way, I think we all need to start with really advocating for making cancer and all NCD as a strategic disease. Same way COVID has been placed in all political agenda as a strategic disease, and has even as in Qatar, the same thing, the Prime Minister dedicated a committee, and that committee directly reported to the Prime Minister because they put COVID as a strategic disease, we need to take care of it. I think we really need to push the agenda that NCD is on a strategic disease level. That will mobilize all resources. For cancer, I think really we need to invest more in risk reduction. If you look at the balance between risk reduction, investment in cancer and treatment, there is no way to compare, like minimal investment in cancer risk reduction and high investment in treatment. So we need to reverse that imbalance, and we need to involve patient more in even at the level of research. I mean, now there is patient participatory research. Patients need to be involved even in designing research, not only like they are part of the research team. For local thing perspective for Malaysia and Qatar, we need to be better in overcoming cancer stigma. Cancer stigma is so strong till now in our region. It's pushing back all awareness levels. I mean, there are so many awareness levels happening, but the stigma is still very strong that is not letting people even opening their mind to listen. And definitely access to service and efficiency.
Okay, thank you. Okay, maybe you. Yeah, please.
Okay. Sorry. Oh, fair enough. You should.
It's more time to think.
So I think looking at the title of what we actually hear today is about the role and responsibility of all stakeholders. And really when it comes to this, we must not just think about us as stakeholders. Give a clever name. I mean, champions, maybe the other group say ambassadors in the advocacy role. But again, this must be holistic, it must be patient-centric and multidisciplinary. No more trying to say that we can do this alone. But one of the things that I would like to stress that again, when Tuan Khairy mentioned about the Minister of Health being the biggest stakeholder, so I think our advocacy role, all of us here, is really looking at how we can support and complement the Minister's Health effort in this, in reducing the cancer burden. So that's my standard.
I would say that all of us in this room have to be ambassadors, but definitely the word I would use as the advocators. This idea about these determinants of health, still a lot of people feel that it is about just lack of knowledge and awareness. They talk about choices. Yes, it is true. A lot of people have almost no choices when it comes to reducing their exposure to risk factors, because people comes in different situations. It is, and you don't forget, for most of us, most of our friends are usually within the same economic strata. So what our norm is not necessarily what the norm of the more vulnerable population. So being able to have that conversation, especially to people outside of health, but who are able to influence the policies relating to health, will be a very key thing for us to focus on. It is something that I focus on at my level at the state. So I do make it my business to attend almost all of the state-related functions. It's very tedious. And for a lot of people, they say, why do you go? Isn't it a waste of your time as director to go to this function which is, attended by the chief minister or attended by the Sultan of Perak? But it is where you build your relationship. They need to trust you first before they start listening to you, regardless of the message that you have for them. Right? So doing these mundane things that takes up a lot of my time is something I feel worthwhile, because it sets up the stage for me to do the rest of the work that I can do at the state level. So I'm not sure how far I can go at the state level, but when I look at my colleague in Sarawak, where state is willing to invest money in health when health is seen as a federal issue, I feel that if they can make it work in Sarawak, perhaps it's something that I can bring back to my Chief Minister, Menteri Besar in Perak and say, we do have some money at stake, perhaps we would consider doing something which is worthwhile. So I'm looking to my colleague, the Director of Sarawak, to see what she can move forward with. So yeah, I can't control what's happening in federal, and KJ has already alluded to how difficult it can be, but there is a second level of government, the state, so I'm willing to give it a shot at that level. Thank you.
Thanks, thank you to all the panelists as well for wonderful views. I want to end by giving you guys a tip, and this is to the healthcare community, especially those who are advocates organizing these congresses and symposiums. And the tip is very simple: stop inviting the health minister. Invite the finance minister. Invite the prime minister. Invite the Ministry of Economy, the Minister of Economy. And that's serious. Of course, invite the health minister. But give that platform to the guy with the money. Money matters. I remember when I was at MOH, I took 2 weeks off to go to the US to attend a ministerial leadership program. And one of the modules was how to talk to your finance minister. As a health minister, I was chosen amongst worldwide health ministers to go, and the module was how to talk to your finance minister. Because the problem is very simple. In climate change, there's a problem called the tragedy of the horizon. What that basically means is that that problem is so far away in the horizon that there's no sense of urgency to act. We don't have a COVID mindset for NCDs and cancer. You need a COVID mindset for NCDs and cancer. The health minister already has that mindset. That's why he has poor mental health outcomes. But you need to have that sense of urgency from the PM, the Minister of Finance, the guys who are holding, the ladies or the gentlemen who are holding the money and holding the resources. So next time, please invite the Minister of Finance. Thank you.
And obviously also the ex-health minister. So this has been a very rich discussion. I'm going to try to just highlight some bullets that came out of that discussion. Health is an investment. That's how we need to be pushing it, yeah? Not an expenditure. This whole concept of collaboration being crucial, building relationships, building trust, have champions, have ambassadors, have a shared vision, ethical approach, yeah? Sharing your credit. Don't always say, I did it. Share your credit. Clear rules of engagement, transparency. These are things we hear, but we really need to, make sure we mainstream these things. Evidence-based policy setting, we spoke about it. The importance of community engagement. How do we better get them involved in health decision-making implementation, balancing of priorities. Sometimes we have the possibilities, sometimes we don't. Yeah, so that's something. And as Tuan Khairy said, accountability is extremely important. Yeah, make sure we make people accountable, and also this concept of continuity. It shouldn't be that just because one health minister or one state director leaves, something is dropped. So those are things we need to think about. But generally, I think the outlook is positive. Yeah, we can look forward, and it's not as negative as things are. But moving forward, there's a lot of stakeholders working together, and a lot of opportunities to work together to make sure that we have a healthier nation. Thank you very much. I thank the panelists. And thank
you so much, Prof. Elil, and our astounding panelists today. Please do remain on stage to receive a token of appreciation. For this, we would like to invite Dr. Santari, President of NCSM, to present the tokens. First off, we'd like to give a token of appreciation to our excellent moderator, Prof. Elil. Next, to our distinguished panelist, Dr. Feisul. Next up, our panelist from the Middle East, Dr. Hadi. Up next, our esteemed panelists, Prof. Ros, and that's all. I'm kidding. We of course have one more. Not forgetting our former Health Minister, Mr. KJ. Not only for this panel session, but for his previous plenary session. Please, can we have everyone to step down on stage for a group photo? Yes, one photo. Thank you so much, everyone. We would like to thank KJ for joining us today and are sorry that he has to rush for his next engagement. We will have another photo session. So with such a unique group of individuals, I think we would like to ask for another photo session, if you may. If we can ask everyone in the VVIP front row to have a stand together at the front for us to capture everybody who has joined us here today. Yes.
Do we stand?
Okay, we've got our cameraman at the front. So no need to move, everyone stay calm.
First row, you could invite the first row gentlemen. Yeah, but the others we can't see. I don't know.
Okay, everyone just sit down, relax, put on your best smile. Today you are the celebrities. Everybody freestyle, Gen Z poses, millennial poses. Thank you so much, everyone. So we'd like to thank KJ for having us and joining us today. He will be missed. So next up, we actually have two special segments to showcase the true spirit of collaboration in battle of cancer. Some background information for those who are not aware. On 17 February this year, as part of World Cancer Day, we announced a special MOU collaboration between NCSM and Axios International to have an international fund financing model. We are now happy to announce the launch of this model called On-Time Access, OTA. This is a new innovative financing model developed by Axios and will be implemented hand in hand with NCSM. On-Time Access adds significant value to the tiered patient support program, a patient support program based on patient affordability using Axios' proprietary tool, the Patient Financial Eligibility Tool, or PFAT. On-Time Access supports includes microfinancing, which offers flexible installment plans with zero interest rates to help patients manage cash flow issues. Additionally, On-Time Access includes partial contributions to the treatment plans of eligible patients. This program will be first extended to patients under the AZ Care program of AstraZeneca, with the initial focus to support the lung cancer patients under this program. We're planning for many more patients to benefit from this. So to launch this program, I would humbly like to invite Dr. Anas Nofal, Managing Partner of Access International on stage, as well as Dr. Sautari Sumasundram, President of NCSM. And to bear witness to the significant milestone, Dr. Nur Ariana Binti Hassan, Deputy Director, NCD Disease Control Division, Ministry of Health, Malaysia. So there is a special iPad here with a special button. And on the count of 3, please don't take selfies. All of them will press the iPad together. I invite the audience to do the countdown together with me in 3, 2, 1.
Imagine if quality care and treatment was within reach for all of us. What would that mean for us as individuals, for our families, and the communities we live in?
Together, we are dedicated to make a tangible difference in people's lives. For the next session, I'd like to invite Dr. Ariana and Dr. Saun to stay on stage. Today also marks a significant step forward in supporting Malaysians battling cancer. We all know the immense physical and emotional toll this disease takes on patients and their loved ones. But they don't have to fight it alone anymore. Today, we will witness a powerful collaboration between Novartis Malaysia and the National Cancer Society Malaysia. I'd like to invite Dr. Bharat Sethi, Country Medical Affairs Head of Novartis, on stage for this. This is a symbolic event where we have the I Can Care app going on with NCSM collaborating together. With this, Dr. Saun. Nobody was hurt. Everyone is okay.
It's a bad sign, we have to stop now.
So Dr. Saun will insert the e-card eSIM into the mobile app, signifying the collaboration of this amazing start app. Do you all want to come together again? We can do it in 3, 2, 1. So let's delve a bit deeper into what this I Can Care app does with a video showcasing more details about its features.
In today's cancer care landscape, gaps in cancer patient information and comprehension remain. These include difficulty in recalling information provided by physicians, exposure to inaccurate online health information, unsure of where to seek emotional and financial support, forgetful about when to take their medications and clinic appointments, and lack of understanding about the disease and their medications, including potential side effects. With these challenges in mind, we bring you I Can Care, a mobile application developed to support patients in their cancer journey. Through collaboration with patient advocacy groups and guidance from healthcare experts, we partnered with a third-party developer to create I Can Care, a comprehensive platform dedicated to enhancing cancer management and patient support. What does the I Can Care mobile application offer? Available in both iOS App Store and Google Play Store, it provides disease information and resources, information about medications, tips on diet and lifestyle management, medication and appointment reminder, support group and healthcare directory, and frequently asked questions. It is available in 3 main languages, thereby catering to a wide range of patient linguistics needs in Malaysia. What have the iCanCare mobile application achieved so far? We do not only develop a mobile application, we develop a future that enables continuous patient-centric empowerment. We began in December 2022, where the application was first launched with fundamental features. The following year, we had more than 700 active users with some function upgrades. Early this year, we conducted a user satisfaction survey to understand how well we have done. And we are thrilled to see that user satisfaction has reached an impressive 81% on average. We are now aiming to delve into de-anonymized real-world data collection, improving our application's capabilities to better serve our patients. Are you interested to know more or to collaborate with us? Write to us at my.medinfonovartis.com. Let us bring your patients to a journey of empowerment. Download now and get in touch with us.
With that, we have officially witnessed the soft launch of Novartis' new iCanCare app. Thank you, Dr. Arya, Dr. Baraj, and Dr. Sound. Next up, we would like to acknowledge our Scientific Committee of NCCM 2024. These individuals have helped to organize the first National Cancer Congress Malaysia and come from varied roles and backgrounds. We have clinicians, researchers, and advocates for prestigious academic institutions as well as government bodies. Their efforts ensured that the very highest standards of scientific merit and integrity were adhered to this weekend, thus setting the bar for future Congress. These are the members in no particular order. Please welcome Associate Professor Dr. Felicia Chunfeli, Scientific Chairperson, Prof. Dr. Abhimanyu Veerakumar Rasubion, Prof. Dr. Goh Bei Hing, Emeritus, Prof. Dr. Chen Sun King, Prof. Dr. Wu Yin Lee, Prof. Dr. Nur Aisyah Muhammad, Prof. Dr. Ho Bo Kong, Prof. Dr. A. Rahman A. Jamal, Prof. David McCoy, Prof. Chin Kin Fa, Prof. Chong Pei Pei, Prof. Kenneth Lee, Associate Prof. Dr. Meng Meng Lee, Associate Prof. Dr. Karen Mei Sin Chan, Dr. Hadi Mohamed Abdul Rasheed, Dr. Lau Zipeng, Dr. Muhammad Fikri, Dr. Eliana Ahmad, Dr. Janice Yu, Dr. Kavinash Renganathan, and Dr. Jason Chin. This is to acknowledge our scientific committee, and we are recording this moment for future congresses. And unfortunately, not everyone could be here today, but please, let's give a round of applause to everyone here. Thank you so much, everyone. And now, the moment you've all been waiting for, the Merit Award. Did I hear it all? The lucky draw will come after this, folks. Don't worry. They're coming. But first, let's celebrate these amazing recipients who were shortlisted from a total of 88 abstracts submitted by scientists, healthcare professionals, and advocates with a vested interest in the cancer care continuum. Our scientific committee, the respected individuals just now you've seen, vetted each abstract, weighing it for scientific merit, novelty, and impact to the Malaysian cancer landscape. Of these 88, 10 of the best abstracts were chosen to be given the Merit Award. With that, I would like to invite each award recipient to come on stage one by one to receive their award. For this session, I would like to invite Prof. Elil to come up on stage. Starting from the 10th place, please give a round of applause to Yu Chen. Next up, we have Dr. Hanisa Hidayatullah. Up next, we have Lu Ewan. Next up, we have Prof. Dr. Rosmawati Mohamad on behalf of Project ECHO. Session. Who are the lucky draw winners? But first, just to clarify again on some rules that were shared earlier, we all agree that the person must be here. Yes? Okay? And it can't be a representative but the person. And secondly, if they do not come up, we will give a chance of calling and asking 3 times. After the third call, if there is no one to claim the prize, we will move on to the next person. So let's get this started and see actually what is our first lucky prize. We have a Faber ceramic cooker for those of you who want to have your late night Maggie, and to have those who are to pull the names out for this, please I'd like to welcome Prof. Dr. Rosmawati up on stage to take out the first 2 lucky winners of the NCCM cards that got lucky today. Our team is getting, okay, don't be surprised to see a big giant box. So it does take a bit of help to get it through. You can pull out 2 names, Prof. Can we have Prof to read out the first winner of our lucky draw?
Chu Koi Lee.
Do we have a Chu Koi Lee? So none of us saw that. Is that the first name?
Yeah, Chu Koi
Okay,
Lee.
so that's the Chu. It is the person. Do we have Chu Koi Lee here with us today? Oh, someone's already like, no, she's gone. She's gone. Okay, going once. Chu Koi Lee. Going twice. And we are moving on to the next name. And all the people anticipating.
I'm lucky. Okay, we have Zaldiana
Zaldiana Raha. Is she around?
Again, Zaldiana Raha.
Okay, going twice.
Oh, you're right, Murali.
Oh, one more time. And we're moving on to the next name.
Maybe third time lucky. Dr. Nur Hashima Abdullah.
Oh, she's here, folks. She's here. She's here. We can move on to the next one. Congratulations. So I know we talked about NCDs, so this cooker should be used for healthy things, not your Maggi, not your Samyang. Congratulations, Doctor. So we have our next prize. A Philips 3000 series blender.
Dr. Gridari Na.
Doctor. Winner. Doctor, now it's time to learn juicing. Congratulations, Doctor. Thank you so much, Prof. For the next two names, I'd like to invite Dr. Hadi from Qatar to please pull out the next two names and let's see what we have lined up. A Tefal 1.8 liter fuzzy logic jar rice cooker. A must-have for all Asian households.
Noor Amiza Zakaria.
Noor Amiza Zakaria, we do have her here. You can never have too many rice cookers at home. Congratulations! While he pulls out the second name, let's see what the next prize is. Oh, very, very useful and practical. A Belkin power bank with 2500 milliamps. I don't know about you, but I have to charge my phone by noon already. It's really
So
ridiculous.
you may need to help me, Doctor. Sorry, I'm not the.
So we have a Dr. Kru Mohamed
Same
Saifullah.
handwriting like my handwriting, so we cannot read it. Doctor handwriting.
Dr. Kru Mohamed Saifullah to Ismail. Yes, Dr. Kru is here. Congratulations.
Very good, Doctor.
Thank you so much. Congratulations and thank you, Dr. Hadi. Okay, almost halfway through, but more to come. For the next two names, can I please welcome our beloved president again, Dr. Saud, to pick the two names of our lucky five winners. Let me see what we have up next. A Philips 4.1 liter essential air fryer, keyword being essential. We love a doctor.
So it's Sarah Bibi Lumbi.
Maybe. Yes, we do have a Sarah. Congratulations. I only started using air fryer 2 years ago and it changed my world. So yes, this is a very wonderful prize to have. Congratulations. One more name coming up for the next prize, which is a Riversong Mag Combo 3-in-1 magnetic charging station. Probably the younger generation.
This sounds like my name. But it's not me. It's Khairy.
And CSM staff and cousin are not eligible for this. Oh, she's coming down. Congratulations. Congratulations once more, and thank you, Dr. Saud. Okay, folks, we're coming up to the big prizes now. Has anyone recently gone on a staycation? Because if not, the next prize we have is a 2-day, 1-night Park Royal Malacca stay for 2 packs. And for this, I'd like to invite Dr. Eliana binti Ahmad from Ministry of Health Malaysia to pull out 2 very lucky winners today.
Ho Pei Ken.
Ho Pei Ken. Do we have? But please come visit Malacca, Dr. Anas, please. We'd love to have you
I
there.
don't think you look like Ho Pei Ken.
Going twice.
Ho Pei Ken?
One more time.
Ho Pei Ken. No, okay, next.
Moving on to the next name of this 2-day, 1-night stay in Malacca. A lot of doctors in the Congress today.
Dr. Rowan John.
Dr. Rowan, a few people standing. I'm not sure they're going to the toilet.
Is it Rowan? Oh, Rosmawati, do you want me to read the phone number? No. Is that Robina John? Yeah. Yes, you see?
Yes, congratulations! It's very good. It's good, sir, doctor. We know doctors need all the support, the help, the rest to recharge that they can get. Came from a doctor, sir. Congratulations, doctor. Don't pull out one more name. What is the next prize? 2-day, 1-night Wednesday in Sunday Resort Hotel. I think some of our delegates are staying here, but let me go to a participant.
Dr. Yusni binti Aris atau Haris.
She stood up, she stood up. We hope all the doctors get a very good rest, ready to serve the nation after this. Congratulations, Doctor, and thank you so much, Dr. Imrana. This is getting very exciting because the next two prizes are even longer staycations. We have a 3 days, 2-night stay at Park Royal A Formosa, Malacca, and for this, I'd humbly like to invite one of the hosts of this prestigious university, Dr. Ahmad Daud Iskandar, Senior Lecturer, School of Medical and Life Sciences, to join us and pull out one name. They're waiting to hear who's the winner.
So the lucky one is Nadia Ashiki.
Nadia Ashiki. Yes, we have a Nadia right next to the doctor. Is that something going on? Okay, no rushing them. Let them take their time. Come safely up. Boleh pergi sambil lembu juga. Belakang. Boleh pergi kota A Formosa juga. Congratulations. Thank you so much, Dr. Ahmad. For the last name that will be drawn, I'd like to invite Dr. Lau Ziping, also a Senior Lecturer, School of Medical and Life Sciences. And the prize we have for this is a 3-day, 2-night stay at Sunway Resort Hotel.
Mardiana binti Muhammad Ali.
Yes, we go! Congratulations! We let her take her time to safely come down. It is a very exciting prize. I would like one to doctor. I have checked my boss. Yeah, I have to check with the bosses. That is our final lucky drawing. Thank you so much everyone for participating, visiting the booth. I hope you all didn't go just for the stands and actually went there to learn something new. So after a long, amazing 3-day event, we'd like to welcome President of NCSM, Dr. Santari, to share a few words for her closing speech.
Good afternoon, everyone. And I know I can't top the excitement of the lucky draw and the eloquence of our past speakers, but I hope all of you can bear with me for a few more minutes. Because I'm really up here to give credit to where credit is due. And I hope all of you are willing to give us those few minutes to recognize the people who worked so hard to make this conference happen. Firstly, I've got the stage, so I'm going to do this, I'm going to act like a proud parent. And actually, when I was sitting there thinking, I'm going to be a proud parent, I just realized I'm no longer a proud parent. I am actually a proud grandparent. Because I have to thank the National Cancer Society. And the little children, as you see around, but also the parent, Dr. Murray. Without their work, Dr. Murray's guidance and the work of all of them, we wouldn't be here today. And it's also the vision. I have to give that. It's the vision that has been born from Murray, and the drive and commitment that has been given to make this happen. And with that, it's our organizing committee as well. We've talked about diversity, we've talked about bridging gaps, about pulling people together, and that's really our organization committee, because they're all from the different disciplines. So, Dr. Elil, Dr. Noriana, Prof. Rose, and all of the other organizing committee members. Sorry, I didn't have my phone up here, so I don't have them with me, but I think I've mentioned all of them. Thank you so much for bringing it together so much. We have to thank also, one is having the organizing committee and the second is the scientific committee. So I'm not going to mention you all by name because you've had a nice show in front of us here, but thank you. And Dr. Felicia, a dynamo. Absolute dynamo. So, thank you. Our partner institutions, I have to say, to Dr. Ariana, MOH, we've always been alongside MOH, but I think as a civil society organization, I can say that it's not anymore that we're just standing alongside MOH, but we're actually holding hands and we're working together so closely with MOH. And from the bottom of my heart, I think, thanks goes to Dr. Ariana to recognize that MOH does not stand alone. It stands with its partners and its collaborators. So thank you. To all our sponsors here, before I get on to the sponsors, I have to also thank our NCSM ambassadors, especially Mr. Partiban. Is he here? He's run away. Who have gathered this diverse group of sponsors to come and be part of this program and to make this program happen. So number one, Summary Medical Center. Thank you so much for your incredible support to making this happen. Novartis, LSD, Gene Solution, Digistain, AstraZeneca, Bajaya, Roche, all of you, thank you so much for your commitment and your belief that this conference can make a difference. I think the unsung heroes here, really, our speakers, that all of them committed to taking time off their busy schedule and the very, very, very important weekend to be with us here today. And the delegates who are here today as well, and the delegates that we've had from overseas. I think, something which started to be just something national that has been recognized and has become worldwide now, in that sense. Having our global friends here to enrich us just shows the commitment of the cancer, the cancer community, not just within our country, but worldwide. And as Elil said, it's what? Local now. Yes? Global. Okay, I'll get that right. It's global. It's global. And, we've put national in front of it. But I think, in terms of the National Cancer Congress Malaysia, I think Worley will come up with a different name for the next time because it's going to be bigger and brighter and wider and everything else. But yes, to our international delegates, from near and far, Brunei, Japan, India, Qatar, Oman, United Kingdom, Kenya, Thailand, thank you for coming, and I hope it's been as enriching for you as it is for us. And we express our hope that you have enjoyed your time here, just not at the Congress, but in Malaysia as well. And then to Sunway University and the volunteers, thank you for making it seamless and so easy for us to navigate the pathways. I have to say that, with everything, I think I've done my 10,000 or 20,000 steps every day, walking from right, left, and center, and learn how to walk in high heels again for long distances, and run with them, since we had a false call at lunchtime today. But thank you, and our collaborators, Sunway University, for providing the venue and their full cooperation. It's incredibly wonderful, and all the volunteers from both National Cancer Society of Malaysia and Sunway University as well. It's been brilliant. That's one thing I've heard from all the delegates that I've talked to, is that the organization of it has been fantastic. So thank you to that. So I'm on my last page, so not that much longer. NCCM, what does that really mean? It's the first of many. Yes, we've had, small pockets of here and there of getting people together and engaging. But I think, NCCM is the first that we've engaged on such a large scale across all the disciplines and specialties, across the whole cancer community and the cancer continuum as well. So it's really here to serve as a catalyst, for cancer researchers, public health practitioners and policymakers to continue supporting and implementing a collaborative movement. And you heard the speakers earlier on. They're much more eloquent than I am. But as Dr. Hadi mentioned, we're here to complement each other, and we're here to break down historical stigmas. And when I talk about historical stigmas, I'm not talking about historical stigmas at all. People are scared of cancer. But I'm talking about historical stigmas between our disciplines, between our specialties, between the clinical fraternity and the academic fraternity, between these fraternities and the non-profit civil society organizations. We have historical stigmas and myths between ourselves that, that have built up a lot of distrust over the years. So today, I hope, well not today, this whole conference, I hope, these 3 days of us all being together has shown how much that all of us have grown, all of us have built our different specialities, but how much all of us need each other. I think that's one thing, we've really learned, is that we're not going to get anywhere just staying in our own lane. As a car moves or motorcycle moves, etc., we have to switch lanes here and there. Yes, there's going to be accidents here and there. There are going to be missteps here and there. But at the same time, we're all moving in the same direction for the same purpose. And that is for the betterment of the life, well, at the moment for the lives of people with cancer, but also to diminish the number of people who need to go through that journey. So that's all I can really say, is I hope this is the catalyst which starts that conversations and those collaborations going. And I hope that everybody has gained the new knowledge, fostered the new relationships, established those new collaborations, and it ignites a call for action. It ignites every one of us. All of us gets a little bit tired sometimes, we're frustrated. And it's easier to internalize everything and just say, okay, I'm just going to look down and just do my work and nothing else and go home. And I hope this Congress has made you realize that, no, you're not alone. We all feel that way sometimes. We've all got challenges and obstacles. But together with with discourse, with the excitement that something like this can harness, we can actually make a difference. And I think, Khairy has shown that it just needs that commitment. It needs that vision, and that needs that collaboration. And that credit goes to everyone, is that we're working together, not against each other. So yes, everybody's been asking me, when is the next NCCM? I'm hiding my face, but it's annual now, is it? Okay. When the family came to me about it, he says we're going to do it biannual, every 2 years. And then, I thought, okay, that's manageable because, with everything else on the list which needs to be done. But now it looks like it's going to be annual. Good luck, all of you. I'm looking to the side here. But yes, looking forward to seeing you all again. Not at the next NCCM, but very much before that, in smaller collaborations together, as we partner together, so that we have a lot more to say the next time that we come together. So thank you again for all of you attending and staying back for the full 3 days.
Thank you so much, Dr. Sawan. It's annual. It's annual, folks. So please save your dates and look out for the upcoming dates for the NCCM 2025. With that, the National Cancer Congress Malaysia 2024 has officially come to a close. For those who need to get, yes, let's clap for that, please. Thank you. For those who need to get their CPD points, please do stay on as we will be sharing it soon. Before that, we do like to hear your feedback as it is our inaugural event. Please do scan the QR code, give back some feedback, any comments, anything we want to know and hear from you, as we'd love to improve and do better. We'll take a few minutes to let you scan and answer the QR code and comment section for a bit. For the VVIPs and other scientific committees, you may have some refreshments outside. Of course, feel free to also let us know your feedback.